Well, definitely going to be a very inspirational month, that is for sure. But right now we are back with Dr. David Naude, homeopath, where we've been busting the myths around colds and flus and also learning about the wonders of the Echinacea plant. Now, as you know, I recently visited Switzerland, the home of Echinaforce, to find out how we can all just get ahead of those winter bugs. But here's a question for you. What if you are in the heart of a cold or a flu? How do you prevent it from going over into a secondary infection? That is what we are talking about next. But to get more information, I met up with Dr. Roland Schoop, the medical advisor for A. Vogel Bioforce, and also Dr. Ross Walton, the MD of Therapeutic Frontier at Imperial College in London, to give us a bit of advice.
Normally, a cold and flu starts with a viral infection. When your immune system is in a good shape, is well prepared, then normally this infection lasts 7 days up to 10 days. When your immune system is really struggling with the virus, is really having a hard time to clear the infection, after 6 days you might go into a secondary complication. And then it's not just viral, then a bacteria might add, and then you get a super infection. And then we talk about pneumonia, we talk about bronchitis, we're talking about sinusitis. And these are very severe infections.
So the aim of these in vitro studies was really to try and understand the mechanisms by which Echinaforce is able to reduce some of the symptoms you might get when you get a common cold, and also suppress some of the downstream effects following the cold, which can leave you open to secondary bacterial infections, such as sinusitis, lower airway involvement, bronchitis, those more severe infections that you might get, which actually are the real complications following the common cold. So the studies found that Echinaforce is able to not only suppress the ability for virus to infect cells in the first place, but also the ability to suppress some of the downstream effects that the virus may have on your immune system. Importantly, the ability to suppress inflammation, which can lead patients open to secondary bacterial infections following a virus. So the two major findings were suppression of viral infection and also inhibition of the inflammatory pathway which happens following infection, which leads you open to secondary bacterial infection.
Very interesting indeed, Dr. David Naude back with us. So there we have it, a quick roundup into, you know, what happens if you're in the heart of a cold or a flu. But I think oftentimes it's not the cold or the flu that you should be worried about. You're worried about the after effects, the secondary infections that can happen. Why do these happen in the first place?
Well, as I mentioned earlier, you know, viruses, when they infect our respiratory tract, they actually cause an inflammatory response. And it's this inflammatory response that gives us all our symptoms. But the other thing that happens when the airways become inflamed is that they open up receptors for bacteria to now come and attach to the airway as well. So these bacteria are floating around in the system, but when these receptors become, they're like little docking stations, and the bacteria comes along and docks onto that cell, and then you have a secondary bacterial infection, making the condition even more serious and more complicated.
And that is the one that we need to try and prevent, because that's the real cause for concern. But the studies show that the duration of colds and flus and the symptoms that go with it, like inflammation and also fever, are reduced after introducing Echinaforce. Now, why is that so important, to make sure that you reduce that period? And also, if you're taking a look at something like a fever, I mean, is it considered a good or a bad thing? Because I think, as you know, me as a parent, your kid gets a fever, you worry.
Absolutely, the dreaded fever. But firstly, it's important to talk about something called immune exhaustion. And immune exhaustion is where, if for every day that you are ill, you are straining your body's anti-inflammatory mechanisms. So when you get sick, your immune system responds and your body tries to compensate by drawing from the adrenal glands, for example, to make anti-inflammatory hormones. So if you're sick often or for protracted periods of time, you actually drain this function. And that makes you more vulnerable to an infection the second time around, or another one. That's where you get your recurrent respiratory tract infections. And as far as fever goes, you know, it's something that parents become very alarmed about. But the biggest mistake is to actually suppress a fever early on. Because by suppressing the fever, there's nothing blocking that bacterial replication or viral replication. You just prolong the illness.
Right, understand. I think this is also a big one for parents maybe to note as well. So don't you know, run away the minute your child gets a fever. Manage it, because the body does kind of need it to fight through that. Now, antibiotics, of course, is often the first thing that we reach for when we are sick. But there is a misconception that it is the strongest treatments, but are they necessarily the best for your health? And that is the big question here. Dr. Peter Fisher, Research Director from Royal London Hospital for Integrated Medicine, sheds some light on this issue.
We have a really big global crisis of antimicrobial resistance. And note that I say antimicrobial, not antibiotic, because although antibiotics are the main drugs, there are also antiviral agents, which are important in this context because most respiratory tract infections are viral, and resistance to them is also emerging. And we have a really big problem, global problem. People are dying already, and many more are going to die from antibiotic resistance. So we need to find strategies for reducing antibiotic resistance. And the existing strategies are actually remarkably unimaginative. They're convergent. They say, you know, we've got to do more of the same, only better. And we need to invent new antibiotics. There hasn't been a new class of antibiotics introduced in over 30 years. So what we need is alternatives, particularly for the vulnerable groups. And the vulnerable groups are the very young and the very old. The problem is you get a viral infection, particularly in children, and it can then develop into something, maybe to croup, maybe to pneumonia, something really serious. And you need to head that off at the pass. You need to stop that happening. I think, if anything, immunity levels, strangely, have declined. And this may be due to early influences. One thing that we do know for certain is that asthma has become much more common. And the reason for this appears to be the hygiene hypothesis. Kids are too clean these days. It does seem that children, for instance, children who are raised on farms get less asthma, children who have older siblings get less asthma than other children. And that seems to be because they're exposed to particular kinds of bugs earlier in their life. That helps their immune system to mature. So possibly, I mean, it sounds paradoxical, but as a result of children being too clean, not getting exposed to bacteria early in life, their immune systems develop more slowly. And there is some evidence that upper respiratory tract infections are getting more common.
All right, so there we have it. So David, after that, you know, we see there are some major risks when it comes to the use of, or the overuse of antibiotics. So we were just talking about it just now. I think people reach towards antibiotics, you know, for no reason really whatsoever, just trying to suppress the symptoms and get better. But is this harmful to our health, and does it damage our immune systems in the long run?
Well, there is research and evidence that actually confirms that. And usually how this happens is an antibiotic has a significant detrimental effect on your microbiome, which is all your healthy bacteria that live in your intestine. And these are intricately involved with your immune system. So if you take an antibiotic unnecessarily, especially for a viral infection, which is not going to react to an antibiotic anyway, there actually is harm done because you are having a significant negative impact on that microbiome, which makes you more vulnerable to another infection. And we all know about the issues around antibiotic resistance and superbugs.
It's a big topic worldwide.
Big topic. I mean, superbugs were limited to the hospital environment historically, and now you're finding them in the community setting as well. So if there's anything that you can do to reduce the unnecessary prescribing of antibiotics is important.
And I mean, that's big also coming from you as a homeopath. So just to impart a little bit of, I think, words of wisdom to our viewers this morning, how do you go about your daily life with regards to natural medicines to make sure that you look after your immune system in the long run so that you can avoid the overuse of antibiotics?
Well, look, there are a number of things you can do, and the first thing is be proactive. You know, if you have a child that's susceptible or showing, you know, multiple infections, is put something in preventatively rather than only reacting when the child gets sick.
Okay.
And the other thing is vigilance. You know, observe your children carefully, and at the first sign of a symptom, intervene or put in an intervention or increase your, for example, if you're using echinacea, increase the dosage. So that's an important point as well. There are other factors obviously to look at as well, as lifestyle and diet, stress levels. These all affect our immune system. And gut health, making sure our intestines are healthy.
By
That's
eating
a
the
major
right
role
type
player.
of foods and incorporating. Dr. David, thank you very much. I mean, very interesting topic. Really appreciate your advice this morning as well.
Sure.
And yeah, when it comes to my family as well, they have been pumped with Echinaforce Junior, and I've been using it myself as well. Brilliant from a management point of view. So there you have it. Take care of yourselves, but stay tuned for more on colds and flu as we tackle this topic on the culinary hotline. You can call us with your questions, and then a little later we discuss that big breakthrough study.
A. Vogel's Echinaforce is the world's strongest herbal product that's clinically proven to prevent and treat colds, flu, and their complications.